This week on the Physio Foundations podcast, I'm talking to physiotherapist Udari Colombage about pelvic floor dysfunction and about her pathway from graduate physiotherapist to PhD student to early career researcher. Welcome back to Physio Foundations for another week where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So in this episode, I'm going to have a conversation with a colleague of mine, a workmate of mine, physiotherapist Dr Udari Colombage, who's another Monash Uni Physio graduate and now a staff member and a recent PhD graduate and an emerging expert in the area of pelvic health and pelvic floor dysfunction and research and clinical practice. So Udari's just finished her PhD investigating pelvic floor dysfunction in women with breast cancer. And last week in our department, we were lucky to hear from Udari in our research seminar series, and where she gave us a really interesting summary of her research and some take-home points that you can use in the clinic. But that doesn't help you one bit because you weren't there. Unless you work at Monash Uni Physiotherapy, you don't get to share any of that. So I wanted to get Udari on the podcast to share this knowledge and her work that she's doing with you, because I think you'll find it really interesting. So Udari Colombage, welcome to Physio Foundations. Hi.
Thanks so much. Thanks so much for having me.
Great that you could come on, because what you presented last week, obviously just in our department, was just really fascinating. The way you structured your PhD and the questions you're asking. I had so many follow-up questions, but we only had 5 minutes for questions. So I thought, let's do this on a podcast. So why don't we start with you? Tell us a bit more about your background and interests and experience and qualifications, all about Udari.
Yeah. So I did my Bachelor of Physiotherapy with honours at Monash University. So that was my undergraduate degree. I graduated in 2017. And, I really enjoyed that course, and it really gave me that introduction to research, which was fantastic. I was lucky enough to study under, now Emeritus Professor Jenny Keating for my research units. And she was just amazing at talking about research, and that passion that she had for research.
Yeah.
Really inspiring. So that really got me interested in research. But during my undergraduate years, I didn't really know where exactly I wanted to research in. I knew I had an interest in research, and I really liked the way research can change the lives of the patients that we work with as physiotherapists. But I knew there was a lot of skills that I still had to develop in terms of, specific researchy type of skills, as well as communication and presentation and data analysis and things like that as well.
Yeah.
So I thought I would finish up my degree, my undergrad degree, and then perhaps, go into clinical practice, experience a wide range of fields, and then sort of look into where I want to get into research. So, I sort of looked for those opportunities, but, at the back of my head, I was still interested in getting into research. So I did sort of have a chat to a lot of my colleagues, as well as my teachers and lecturers at the uni. And one of my very inspiring mentors has been Dr Sui. So I talked to Sui, and I sort of said, I'm really interested in research. How do I get into this pathway to become a researcher in this field? And she sort of, asked me to reflect back on where I have, worked recently, and, where I really want to research, what sort of field I want to look into. So I took that advice back, and I worked for a couple of months. I was sort of working in private practice, as well as doing some locum work in rural Victoria. And in that role, I was sort of working across a lot of different cancer clinics.
Okay.
And working very closely with women with breast cancer for quite a long time. They were really in need of physio services there. And, a lot of my skills there were very foundational. I didn't have any specific training in women's health or, treating women with breast cancer at the time. So I was relying quite heavily on some of the senior clinicians that were in that area that had experience working with these women.
And they were happy to mentor you because you wanted to be working in that area, and also it was in demand as well.
Absolutely. And they really needed the help as well. So, it was a priority for them to put that time and effort into me and my skills to try and, get that role and get that skills up to scratch so that I can be providing these services to people that live in that rural Victoria side.
Mm. And so go on.
So I had a couple of months under that team there in rural Victoria. And there I really enjoyed working with women with breast cancer. It was, I found a passion of mine. And, I was really doing a lot more of that lymphedema treatment and, sort of endurance and strengthening type of work post-surgically rather than anything specifically related to pelvic health. But I did notice a couple of women that were struggling with incontinence as well as sexual dysfunction, which was quite a well-known complication of breast cancer treatment. But, as I tried to seek guidance from a couple of the senior clinicians, we really didn't know how best to help these women. And we sort of looked to literature to see what was already out there and, how we can be guided by the evidence that's already out there. And there really wasn't too much available for us to, go get on with at that point. And, we just sort of assumed that, anything that would work with women with breast cancer would also, or women without breast cancer would also work with women with breast cancer. And we just sort of, went through the normal pathway of pelvic health, and we're just referring women to that health services that are sort of already out there. But, as it is with all services in rural Victoria, it's very, very low and the demand is very, very high. So, we were directing these women to these services, which, we didn't actually know if it was going to work. We just knew what was best for our clients and what the evidence had shown us. But, it didn't really sit well with me that this was what we were doing. And I sort of wanted to contact the experts in the field in pelvic health specifically. So luckily, Associate Professor Helena Frawley, who is an expert in pelvic health in Melbourne, was working at Monash University at the time. So I reached out to her and chatted to her, and I also sort of explained my interest in research at the time. And she sort of, took a lot of time to sit down with me and discuss, where to sort of go from here. And we did a little bit of background work and reading and and we just sort of planned out this whole research degree that sort of came about together in the 4 years after that. So it sort of came, from one thing to the other, and I wasn't expecting to go down this degree. I had the ambition to do so, but I really didn't know how to really get started in the field. But I'm really happy that, I went down this path, and I've just had the most fantastic mentors to guide me along the way.
Yeah. Your PhD was really driven by the clinical question, not necessarily by the pathway that you were going to go towards a PhD. We've talked about that before on previous episodes, the motivation for doing further study and doing a PhD. It's really, this is the dream interview because you are answering all the things I wanted to ask you. It's really, really easy. It's really good. So in the undergrad years, you said something that's a touch unusual in that you really enjoyed research. And then you came back around, you said, okay, I've got these clinical problems that I need to look at the research to answer. And the research is a bit threadbare and lacking. And that's where you can contribute, do your PhD and actually do that research. So it's a really nice circle that you found in sort of 4 or 5 years of practice. So if we go back a step, what did you enjoy about research? So in an entry to practice degree, there's always elements of research.
Yeah.
What about it was enjoyable?
I think the main thing for me is I remember having a very specific lecture by Emeritus Professor Jenny Keating, and she was talking about how we can disseminate the results of research and how that can then, translate into practice. And, she was saying that, it can take, up to 6 to 9 years for research to actually translate into practice. And I just thought, wow, that's a very long time. And you think that, you publish one paper and you can just change the way physios are working all around the world. And, that's really not the case. So she was really pushing for research, and she was really trying to explain that as physios, we are lifelong learners, and a part of being a lifelong learner is to be curious and, looking for things and questioning things and trying to understand how things work a little bit better.
Oh, yeah.
And I think that was just the most fantastic thing to really inspire us to go into this path of research.
And it doesn't have to be something that you apply to research or go on and do the research yourself. Just to be curious and investigate things and ask questions
absolutely,
and be a lifelong learner is such an important part of this career this career path we're all on. So then you're in a PhD, which you're passionate about because you've had that experience working with people, and it's driven by the clinical questions. And actually, an interesting point you made was about some of the work you were doing with people prior to having experience in doing pelvic floor examination and the like. So it was treatment that anyone with a physio degree or other related degree could do. So you were doing, I guess, lymphedema treatment is a specialist area, but you're doing other things, endurance and strength work, and working on function and rehab goals post surgery.
Yeah.
Can you tell us a little bit more about that? Because I'm talking now to graduates or people working in clinics, and they're thinking, I might be coming up on a rotation or a private practice work. I might be embarking on private practice work, and I may be working with these people.
Yes.
So what's some of the non-pelvic floor examination work that you can do with, or non-pelvic floor work you can do with people?
Yeah, so very early in this role, I was looking specifically at women after they've had their breast cancer surgery. So working a lot on their range of movement of their shoulders.
Right.
As well as strengthening of their shoulders and the muscles around the shoulder. That was a priority. And also just sort of getting them up, mobilizing, and, getting them into these aerobic exercise sort of programs was one of the main things that I did. And I also ran an exercise group, which included a lot of women with a lot of different types of cancers.
Okay.
And that was only because, the demand was very high. And again, there wasn't anyone else running these programs in rural Victoria at the time. And that was mainly what I was doing. And as I went along in this role, they realized that they probably need a little bit more help, specifically with lymphedema management. And I had a couple of the physios work one-on-one with me to give me that training, and also attending the APA course. There was a weekend course.
Yeah, so that's Australian Physio Association for the overseas listeners, or to get the courses, formal training, plus the mentoring and on-job training in that area. Yeah,
which was a really good introduction to everything, and looking at and having that ability to have a mentor there, but also apply my skills into actually putting it into practice straight afterwards was really good for me, because I could see how things worked and I could really learn quite quickly that way. And then, having that skills and, having that mentorship there was fantastic.
So you probably did very little of that training in your undergraduate, or we could just say an entry to practice degree in your first physio degree. Did that matter? Is it often a perennial topic of conversation is how we need to be adding more and more and more. We don't have enough of this and don't have enough of that. But how did you can't just keep adding as well.
No.
So you need to prioritize. So how did you manage that? How did you find working in that specialty area and training up on the job effectively to help people with lymphedema?
Yeah, I think I had a lot of that sort of foundational knowledge from my entry to practice degree, and it was just about building on that skill. You know, there's very little that we perhaps don't know from our, you can't just say that I didn't know anything about breast cancer from my entry to practice degree.
Sure.
So I did have a lot of the foundations, but it's about going into it that little one step deeper and, understanding how one thing can affect the other. For example, lymphedema, how can that affect the way we move our arms and actually, do a lot of the things that we normally do with the arms.
So having the principles and having a strong foundation in principles and skills that you then apply to specialty topics and areas is the whole point. That's why it's called Physio Foundations Podcast, what we're talking about. So then tell me about those skills, a bit of a segue here with lymphedema, but what are some of the treatments and techniques that you do? Yes. What is, I know that listeners will be very familiar, what is lymphedema and what are some of the skills and techniques and management that you use?
Okay, so lymphedema often happens when, so after breast cancer surgery, you might be working with some of the lymph nodes within the area, especially very close to your arms. And when the lymphatic system is blocked, that lymph fluid can be pushed out to the limbs, and lymphedema can happen in the arms or the legs, but it's mostly common in the arms for women with breast cancer because of that lymph nodes that are around the shoulder joint and underneath the shoulder. And some of the techniques that we use is we can do a lymphatic drainage sort of massage, as well as the compression bandages that we use, so that you do it a very specific type or a very specific way to wrap it around. And those are some of the very sort of specific things that we did for women with breast cancer who had lymphedema. The other skills were around scar tissue management after breast cancer surgery. That comes a little bit down the line of, how do you massage that scar and how do you also try and stretch it out a little bit afterwards.
Yeah, that's interesting. And those skills they're simple things that are done well and done very specifically for that specific problem. So you've got that foundational training and then you've learned how to do that with that population. And so that's the physical part of it. What sort of psychological impacts are there for the women who have lymphedema and have this surgery? So, and I guess a follow-up question is, as a new grad physio that you're young and you just graduated, how equipped did you feel to recognize the psychological impacts and to have perhaps contribute to the positive, psychological parts of the rehab? And maybe when to refer on. Can you tell us a bit about the psychology of it all?
Absolutely. And that's, I guess, some of the harder parts, I think, as a new graduate going in. I was very fortunate to have a placement at La Trobe Regional Hospital, specifically in their cancer wing when I was a student. So I had a little bit of experience with treating patients with cancer in general. But what I've found is patients who've had treatment for cancer, they're quite strong and they're quite motivated to sort of, get that treatment at the time and then move on from cancer as a whole when they can. And that is what their focus really was, is, how do I go back to my pre-cancer sort of activity level, and how do I get back to that pre-cancer life is what their focus really was on. So that aspect, so what are your goals and what do you really want to get from physiotherapy was what I really focused on as a new graduate. And I really kept things very close to what I wanted to achieve and just linking that together and making that bridge between where I want you to go to and where they want to go to. And finding that happy place in between was what I really looked to as a new graduate physio.
Yeah, that's a really good answer. Really interesting. If you think about it the other way around, if you're not having a patient focused or a goal focused approach, I don't know how you could do it. You're working on impairments and things, and not really thinking about the person and what they want to do and how they're recovering. So, yeah, another great answer. So tell us a bit more about pelvic health. So then you had these general skills. You were there, and then did you do any postgrad training in women's health or
Not
so
at
it's
the
all a part of your
time.
PhD? So yes.
Yes.
So where did you go next from
Long
there?
time. Yeah, so while I was treating these women, a lot of them had problems with sexual dysfunction, and I had a couple of women telling me about incontinence specifically. And then, sexual dysfunction is very well known in women with breast cancer, and that is something that they sort of warn women about prior to having treatment. And that's a combination of, yes, you can have physical impairments in your pelvic floor that can contribute to sexual dysfunction, but there are also very sort of psychosocial factors there as well that can impact on sexual dysfunction. Compared to something like incontinence, where we didn't really have too much information about that in women with breast cancer specifically. And that was when I went to my mentors and when I was in my undergrad degree, I was told about incontinence, and I was told that we do pelvic floor muscle training to treat incontinence. Is this something that we should be doing for our women here? And they said, perhaps, they went, if it's going to work for women without breast cancer, it might work for women with breast cancer. So let's give it a go. Let's refer them on to these continence services that we have in that region. But the wait list is about 6 months plus at the moment. So we referred them on. As it always happens in acute hospitals, we didn't really know what the follow-up was like. We didn't really know if women actually took up that opportunity to, whether they even waited the 6 months or whether they actually went outside and saw a pelvic floor physiotherapist privately. But it was, giving them that information that was really important, I think, is because no one really knew about it, and we didn't really know what we were doing was correct, but we knew that they needed to have some sort of follow-up.
Yeah.
So it was really nice to be able to give them and get them on that pathway to getting some treatment for pelvic floor dysfunction. But again, that's when it got me thinking, is this the right thing that we're doing here? If there is nothing really out there, then I think I really need to be contacting some of the experts in the field to see, if there is anything else we can do at this point.
Well, there might be people listening to this who are thinking about all the different areas that they can go into, and you don't have to choose one. You can move through various areas in your career, and they might think, hey, I could follow a similar pathway to Udari, and I could really contribute in that much needed area. So people currently in that region have a 6-month wait list. That's a long time to be waiting for that sort of help with a problem like urinary incontinence.
Absolutely.
And sexual dysfunction. That's something where you made a direct difference for that period of time, for working in that area, cutting down the waiting list and seeing people and helping them.
Exactly right. And, it could be as simple as directing them to the Continence Foundation of Australia website. Like, they've got some fantastic resources that are free to access. It explains everything about why they might be, experiencing that incontinence, and it just gives them a starting point to sort of, understand what's happening and maybe where to go and get treatment for these things. And, I'll talk about my research a little bit later and what I found from it. But a lot of what women were saying is they were trying to seek treatment and asking questions about how they can get treatment for this. And they unfortunately didn't get the answers that they were looking for, as either they were brushed off saying, let's focus on cancer treatment at the moment, or they were, they just didn't know, they didn't have any information to give out about incontinence for women with breast cancer.
So that's my question. And that's the final question, which you've just touched on. So how can the general physio, which I count myself as, contribute and help when we meet people who are, for example, women with breast cancer, who have these symptoms like incontinence, sexual dysfunction, first of all, how do you find that out? So screening and an interview, I guess that's a separate question.
Yes.
And secondly, what can we do? Where can we refer people to? So you sort of touched on the Continence Foundation website, and I'll pop that into the show notes.
Yes.
For people to look up.
So on the Continence Foundation of Australia, they actually have a specific section for professionals.
Okay.
And under there is a fantastic module there for pelvic floor assessments, examinations, and management. And I think it's a 1 or 2 hour module where clinicians can just get educated on what to do, how to actually ask these questions. What's the wording that you should be using, and how do you sort of maintain that dignity when you are asking these types of questions, as well as doing a pelvic floor examination. So that's a really good module. So you will have to sort of log into your healthcare professional logins to access that resources. But that is out there, and I think that would be the first point of call if you are a clinician looking into treating women with breast cancer who have incontinence.
There you go. So that's really helpful. And I'm just trying to be cautious of just directing people who have a special interest in this area or people who are currently working with that population to those sort of websites, and just sort of encourage anyone who's working anywhere near perhaps a general private practice or outpatients to have a look at these resources, because we will all be seeing, if you're working as a physiotherapist, we'll all be seeing people with a range of conditions, right?
Yes.
And go on.
And, a website like that is really good for just the consumers or our patients as well, because it just, puts everything into layman's terms. It's got beautiful diagrams there of, what might be happening and how to actually contract your pelvic floor. And it sort of guides you through the pathophysiology, as well as how to sort of seek treatment for it. And it has the links there if they want to sort of self-refer as well to any services. So I just think there's a lot of resources on that website. And I have previously, sat down with a patient and gone through that website, and they were just so enlightened by all the information that is out there. And it was just a one-click stop to, all that's out there.
Yeah, Christian Sadnik, who was on a few episodes ago, who we both know from Monash Uni Physio. So Christian talked about being resource aware, which was such an important skill in the current age, where there are things available for practitioners, such as the Continence Australia website with all the resources and information that you've just described, that you might not know about. And just by becoming resource aware and bookmarking that one and then sharing it with people, and that's why we're having this conversation today, to share this knowledge, you can step out of the darkness into the light.
Exactly right.
Quoting Pantera lyrics now. And then have that, and just have such benefits just from one resource. So I'll put that in the show notes as well. You alluded to your PhD findings a couple of times, and we're going to do part 2 of this conversation just so we can give it the time that it deserves, because you've got quite a story to the series of studies you did in your PhD. So that's going to be specifically about urinary incontinence for women with breast cancer. But it's not, if you don't identify that as your topic or your special interest area, I encourage you to have a listen anyway, just to think about the way to ask questions and the way that Udari went through a series of studies, but also just have a think about how you could ask similar questions in your area, or if you work with or happen to work with people who have urinary incontinence or sexual dysfunction, you can get more comfortable with, potentially asking the questions or referring them on. So that I found there was a lot in that presentation, and I thought it was really good. So we're going to basically do that presentation again in the next episode. So stay tuned. That'll come out the week after this one comes out. But anything else that you wanted to add on the general pelvic health or general topics we've been talking about today before we get into your research?
I think it's very important that we don't sort of shy away from, talking about incontinence, especially if you feel that this is someone who's at higher risk of developing incontinence, because we do know that disclosure rates are very low in women, specifically. So, just don't shy away, get educated, know the proper way to ask these questions. And, if you identify that this is something that they want help with, there are resources out there to help you direct them in the right way.
Brilliant. That's a great summary and really good advice. So thanks very much, Udari. Well, we'll leave this episode here. We're going to come back and talk about your PhD research and what you found in the next episode. And then perhaps at the end of there, we'll talk about, lead people towards your more research, social media research, websites and everything else. So thanks everyone for joining Udari and I in this conversation, a really important topic. And as usual, just keep sending me your emails and DMs that are coming in. Eventually I'll get around to giving some of you shout outs for some of the ideas you've given me for episodes and some of the comments and engagement that you've been doing. So, but thank you. I do appreciate. Keep sending them in, and you can track me down. All the details are in the show notes on social media, and find my handles in there. Udari, we'll leave. I was going to ask you if you're on social media and if you've got any. That's a no. All right. Probably a good idea. Stay off that. But it can be a dark place. But we'll put your details in the next lot of show notes. But thanks very much for a great conversation.
Thanks, Luke.
So until next time, this is Udari and Luke wishing you all the very best with your studying, professional development, and lifelong learning.